I'm glad you made it.
All right.
First of all, I'm very glad you made it. It happens. It happens to the most timely of people, all throughout Atlanta. I think the most important thing that you learn today is one of the principles I actually share in this class, and that is time is so valuable. I mean, it's so valuable that I usually thank people for being here, because I mean, if you've been on Interstate 400, I-20, 285 at any point in your life, now up in New York, this really doesn't get that backed up.
We'll go home.
That's right. It's like gold. Time is like gold, because it's so valuable in Atlanta. We're busy schedules, busy everything, so thank you for being here and taking the time. What I want to do today is start with a question to each of you, and that question is this. It's probably not very profound. It's not like, oh wow, I've never thought of that, but it is one simple question. What is chiropractic to you? And I'm going to go through everybody today and just ask, just to get your ideas of what chiropractic is. So June, let's start with you. What is chiropractic?
Well, chiropractic to me is relief of pain, and it doesn't last permanently, but it does give me some relief.
Good. So relief of pain.
Right, that would be my statement.
What about you?
I was going to say the same thing, only mine's been fairly permanent.
It's what? When it goes away?
Yeah,
Good.
since the first time that you've adjusted me. She'll always say, Mom, be careful of your back, be careful of your back. And
you're taking care of her, huh?
I'm like, no, that's fine.
Jesse, what about you?
It's a miracle.
It's a miracle. I like that. I like that. I remember the first day when you got adjusted that first day, you're just like doing those knee bends. It was pretty exciting. Yeah. What about you?
It's great preventative medicine, like down the line. I don't think I get as sick as I normally would with things, just like common colds and things like that.
I like that. I like that. So not only is it just pain management, helping pain go away, but also it helps other things and helps your body work better. That's good. May, how about you?
I think it can be a lot of things if it works.
If it works,
if it works, it can be freedom, or be you have a great life, healthy life, and everything. So, but most people seek chiropractor because their back pain or something like that.
I see. Yeah. Your definition is great. I'm going to add a couple things to it just to enhance it. It is the relief of pain and symptoms, but did you know that that's not my primary focus? My primary focus is the health of the spine and the nervous system. Now it sounds like it's probably the same thing at first, but it is a very different and unique process. My goal is to check to see if people are out of balance. People will have some kind of accident or injury. It'll tear loose connective tissue of the body, and then it'll cause it to break down and lock into a stress position just like this. Now, every single person in the room, and I'm not sure, you go to doctor, everybody in this room then knows what this looks like. They know what this feels like now, and this is not a normal position for a body. Okay, this is from some kind of trauma, some kind of injury. But what my job is to do is take care of the spine by removing that imbalance and bring in a person so that their spine is straight. That's what we do. When we do that, the nervous system then can communicate at 100%. When it communicates 100%, it's not just to the muscles of the body. It's like what you were saying, it allows things to function and communicate back and forth all the time. That's my goal for everybody that comes in. Second question for you. Okay, you ready for this one? The second question, and this is a yes, no, or I'm on the fence on this one. Okay, can chiropractic help other things than just back pain or pain type situations?
Yes.
Yes?
Yes.
Yes. Yeah.
Absolutely.
Okay.
On the fence, yes to see.
Good. I like on the fence, or I like no. You know why? You're probably like, why? Why do you like that? Because I was no. I was honestly no when I went through my education. I don't get it. I went to become a muscle and bone doctor, and that's all I was going to do. I was going to maybe stretch some ligaments and get things working, moving. But when it came to the nervous system and how it works and communicates, I didn't focus on that in school at first until I was in a class that this doctor was talking about this procedure, something similar to what we do here. And that's when I started catching the wave of information of how this all works. See, I am now, out of no. I went on the fence for a while, and I'm completely on the yes side. Do you know how I became that way? It was through you guys. It was through seeing people that came into the office, taking care of them. All of a sudden, migraine headaches going away. Their body was functioning better. I'm going to show you some examples today of people that had some digestive issues that all of a sudden just clears up. Okay? See, my job, my primary focus and my only focus is the nervous system. I'm not here to cure your headaches. I'm not here to cure your back pain. You're probably like, what do you mean? But you're not here to cure that. My primary job is to correct the spine, remove any kind of interference, any kind of pressure to the nervous system. And when I do that job, and when I do it well, all of a sudden we get those miracles. Okay? That's as simple as it is. So if you ever walk out of this office and go say, you know what, you got to see Dr. Selman, he's going to cure your migraines, I'm going to deny it. That's not what I correct. Have people been helped by me correcting the nervous system, allowing things to function again? Absolutely. Everything comes back in check and starts working the way it should. But again, my goal is this: getting the spine aligned, putting everything back in position where it needs to be so it can function at 100%. All right. Any questions on that? All right. What are you here for today? The do's and don'ts, right? What not to do outside the office so you don't undo what we're trying to do for you. See, that is one of the things that I think a lot of people come in here not realizing that there's a lot of things in their lifestyle, computer situation, working at a computer all the time. TV, is your TV lined up to your chair? Or is it just over here and you're sitting like this all the time? I was over at my in-laws' house the other night, last night, and I saw my grandmother, or my wife's grandmother, sitting in a chair faced this way, and she was listening to somebody playing the piano over here. What kind of support does that give your body? I don't know if you noticed, but the chairs that we put in here, we didn't put them straight like an audience. We made them in an arc so that everybody could actually focus in straight at the board or at the view box of what we're going to be talking about. Okay? Those are the types of things we'll talk about. There's a sheet that was given out, and I think they all went over here, actually. So you can pass one of these out, just passing those across. On there is listed back here instructions, the instructions of what not to do. We're going to talk a little bit about some of those, but those are important to read through and to go over. But the first thing I want to actually ask somebody to read on there is the first bullet. Go ahead and read that for me. Go ahead, Jen. Yeah.
The spine is the center support of the body. You must respect this structure so that it will give you strong, flexible service for a long time to come.
So the word that's in bold, what is that? Who in here likes being respected? Right? Especially parents, just so you know. Just clue you in on that one. Respect is a huge issue. It's something that not only we like in the world with other people, but our spine likes to be respected as well. But the thing is, we're not really trained in that we need to respect this. How many people here have actually had a spinal hygiene class in high school? You're giving me a face like, what do you mean? How many people here have had a spinal hygiene class in college? After school? Nothing, right? Here's John. Actually, his nickname is Skinny. I don't know why they call him that, but Skinny, if we constantly abuse the spine like that, and it is constantly banging on it, from extreme sports, water ski jumping, roller skating with your kids, trampolines. If we're constantly abusing our bodies, guess what? It's going to pay us back for what we put into it. I mean, it's the same thing as if we eat well, we get out what we put in. Okay? Same thing with the respect issue. If we don't respect the structures, all of a sudden a straight spine, did you see what happened? I didn't touch it. Do you see how down the lower back is crooked now? Just from that one impact. And so we got to be careful of how we manage this and how we work with the spine. And that is where I partner up with you to do that. It's not me helping you only, okay? It's me helping you, you helping me on the outside. Between that, we come together at a common goal, and that is bringing health back to the body. Okay? Any questions on that? I'm going to explain to you what happens, end stage. Let's go to the end stage. And when I say end stage, that means that a person's been around for quite some time, and their body just got to the point where it said, enough is enough. I'm not going to be able to handle this, not going to be able to do this anymore. This is a gentleman that came in, he was 75 years old. He sat at the table, sat across from each other, and I said, what is your main concern? And he said, nothing. And I said, well, then why are you here? And he said, well, he crossed his arms, my wife sent me. All right? I knew something was going on because nobody's just going to come in just because their wife said, as much as he wanted to blame that on his wife, there was something happening. So as we started talking more and more, I realized there was a lot going on. He had a lot of degeneration in his neck, breaking down. He was losing control of his leg on the right-hand side. His his toe was dropping down because the muscles and the nerves weren't functioning the way they should. And so all of a sudden he was starting to have gait problems. He couldn't move as smoothly as he should, and he started falling a little bit more. Okay? He came in looking to have it fixed. As we started taking care of him, he started going downhill. Usually we want to see that care or the progress go upward. And what we saw was this person that was starting to go downhill, I had to send out and refer out to an orthopedic surgeon. The end result was they recommended a surgery. And you see these screws right here? Okay, that's a metal titanium plate that has been bolted to his neck and the three bottom bones in his neck. You know why they did that? It was to try to stabilize the spine. And that little crosshatch thing, that's like this little mesh, wire mesh that they wrapped around there to try to solidify it all together. This is the bottom part of it. It's right down in here, but this is the bottom part of that metal rod. Look how long that is. I mean, it comes down to right about there. And that's the bottom screw right in there. Okay, that's end stage. I mean, that's where somebody goes through all the stages of degeneration and gets to the point where their body is just not going to deal with it anymore. He went through surgery, came back in, and then he still got his spine checked. I'm going to show you some other examples today of what that's like, but there is a point where somebody gets to that the body is limiting the forward progress. Okay, that's what we want to share with you. I don't want anybody to go there. That's just this position that we don't want to see anybody go to. Now, a lot of people in the room would probably say, well, yeah, okay, that's fine. That's not me. No big deal, you know. But the problem is, when does it start? Well, from what we've seen, this is a 10-year-old little boy. Look how crooked that is. That's a picture of the whole spine from this angle, from the front view. 10 years old. I mean, what could have created that to make that person, that kid, bend so drastically off to that one side? After we took care of him, look where it went to. Okay? I know some people have asked me in the past, you know, well, okay, my spine's crooked, but what's it going to do in the end? Okay, my goal is to get this to happen on every person that comes in, is to bring the spine out of a state of imbalance like this. Remember what I was talking about in the beginning? It goes back to these guys over here, is to bring them from an imbalanced state back to a straight position. And when we do that, it decreases the degenerations in the hips, in the low back, all the structures up in the mid back, the shoulders. It allows the nerves to communicate the way they should, all throughout the whole body. The thing that you don't see on this film is what? Soft tissue. It's the stomach, the organs, the lungs, and all those things. And also you don't see the nerves branching out of this area to those issues. This child right here should be nice and straight, just like this. Obviously it's not. Upper cervical care, right? How do we do that? Do we touch the low back? Do we touch the mid back? No. We touch here. We adjust through the top bone, allowing the structures to come back in alignment so that everything functions the way it should. And we go to what I call the root of the problem, instead of focusing on the other issues that are sort of superficial issues. This is a very interesting thing. Has anybody here not seen an MRI before? Do you know what an MRI is, Jesse? Okay. What I'm going to show you is what the MRI looks like. And then I'm going to explain just what happened with this person. Now, just give you a little history. Patient was 35 years old when she came in, very much into extreme sports, water skiing, jumping, and biking, mountain biking, and just she had a lot of falls, a lot of injuries, a lot of impact. If you look here on this picture, you see those white areas right there, those like sort of marks on the film? You see the squares in between? Mm-hmm. Those squares are the bones. The white areas are the disc. It's the healthy part of the disc that allows our body to bend and touch our toes and be flexible. The problem is when you come down here, it's white, 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 and all of a sudden it turns dark. On an MRI, what that means is that the water in the disc is coming out. There's no more fluid in the disc. And so what that also means is that the disc is starting to compress, and then it starts squeezing nerves and start causing all sorts of problems. So there may be problems down the legs, sciatic problems, there might be pains up and going upward. All sorts of things can happen. The other thing I want you to notice is you see this white line back here, and all of a sudden it's smooth until you get to this point right there. You see that sort of bump? Mm-hmm. And here's another view of it, a slightly different angle. It's a large bump. Okay, that's what we call a disc herniation. And it's a severe disc herniation where the body has been compressed for so long. Let me put it real simple. Here's where the person was for 10 years. Pounding, running, jumping, constantly hitting. Next thing you know, it wears out. You like Oreo cookies? I love them. Okay? I always do this class after lunch so that I can talk about cookies because otherwise my stomach goes crazy. Well, I like the double stuffed ones, because when you can take the top off and make a quadruple stuff. Have you ever done that? You've never done that, have you? You're going to go home and do it, aren't you? Well, just imagine that quadruple stuffed Oreo cookie, monster cookie, right? Well, imagine that pressure. If I'm leaning over and putting pressure on the disc from the bones leaning, where's the filling going to go? Right? If I lean over here, all of a sudden the filling's going to go the other way. If I lean backwards or forwards, it's going to go backwards. If I lean backwards, it's going to go forwards. And if I'm constantly in those positions, in one position over and over and over again, it's going to keep on pressing until it goes and it releases. And that's where you get a very severe, if it's a herniation, it can go to where it pops and it puts all sorts of pain up and down the body that you can't believe. So I say that with the Oreo cookie, that explanation, and just to explain that that's what was happening over years and years of this area. And if you look, after we took care of her, see, this lady was on bed rest for 4 weeks. 4 weeks. Not doing anything. Couldn't work, was on disability. Came in, we had a month to work with her. I said, honestly, I don't know what I can do for you. I said, you have a very severe herniation. I'm willing to try if you are. She didn't want to go surgery. She was scheduled in a month. We did a pre-op film just the day before surgery. And look at how it's reducing. She was able to move better. What is it? Was it a miracle? Hallelujah, wow, this is happening? No, it wasn't that. It was time, little steps over time that we were able to get her from one place to another. And when we did that, all of a sudden the doctor looked at this and said, what have you been doing for yourself? And she's like, oh, I've been going to this upper cervical doctor. And she's like, really? What's that? It doesn't really matter what it is, just keep doing it. And they canceled surgery. That's a month after, and then this is a 7-month follow-up. If you look here, look at how smooth that is. Look at that. There is no more herniation, no more bulge in the L5 or the low back. Now the good thing also, did you see what's happening with the whiteness? You see how it's coming back in this one? That whole area is taking the pressure off the Oreo cookie, bringing it back to normal. Then we allow it to stay there, stabilize, and then over time it heals. Okay, that's what you are going through the process of. Okay, any questions on that? Hello? Again, where did I adjust the person? Right here. But the problem's in the low back, doc. The problem was up here. And what that did was set up problems down the spine later on. What I'm going to do, let me go ahead and show you something before I show you these other films. There's a patient that came in, and she was from an auto accident. So the auto accident really set her up for some problems that she was going to be dealing with. She didn't even realize what they were, though. She came in for low back pain and then neck pain because of the auto accident. Doc, can you help that? I said, well, let me see if you qualify for what I do. Well, her head looked like this, so I said, yes, you qualify. We took a picture, we analyzed it. I adjusted from here. You see how the red line is? That's where she should be. The black line is where she is. This is what we did afterwards. You see how it straightened out? Now, that's the neck. So just remember that she was corrected and adjusted and put back to where she needed to be. What I'm going to show you next is her full spine views. Now, some of you might not have ever had these taken for you before you got cared. These are very helpful for me to see exactly what's happened with the spine. Do you see this area right here where the X is? That X should be on that black line. And so what's happening is there's this twist right about here where it's almost like a monkey wrench came in and just twisting that whole spine, shifting it over. So when this person walks, it's like this. You see my spine? It needs to be shifted over here. And so what's happened, the person was in major low back pain, all sorts of neck tension. And then from the films before you saw, you could see that the spine on the top was off. So the whole spine was misaligned. After I adjusted, all this started coming back to center. They didn't have that crank in the middle like it did, right through here. You see that? The other thing I want to mention that this is a great story. So just when she sat down in the room and we talked at the table, I said, well, is there anything else going on? She had neck pain and low back pain, and that's all she wanted to talk about. And I said, do you have any constipation or diarrhea? And she's like, not really. Okay, and when she said not really, I clued in, okay, to that there is something, but she just doesn't want to talk to me about it. You can't help that. It's not going to happen. I let it go, and I sort of went back into the exam room, and I was feeling through her back and the low back. See, this area right here, when I was feeling in the exam even before I took the x-ray, I could feel that there's a lot of tension in between 1 and 2. It goes out to the large intestine and small intestine. The other thing I know, after we took the x-ray, I asked her, I said, at that time, I said, are you sure you don't have any constipation? She's like, well, yeah, but I've been dealing with that for 15 years. I said, really? I didn't say that, but I just asked, so 15 years, tell me about it. And she said, well, I Herblax, Exlax, any kind of medication to get myself going, I've been doing it. Metamucil, nothing's worked. Imagine being bottled up for 15 years and not being able to do it, anything. You can see it on x-ray. Do you see these pockets of air? That's gas, all backed up. You ever, so that bloated feeling, that pocket of gas, and then all of a sudden down here you can see a blockage. Look at the other film. What don't you see over here? They came out. She came in the room 2 days after I adjusted her, or after the next visit after I adjusted her, and she's like, like a little kid in a candy store. She's like, looking around, making sure the door's closed, the blinds are closed, it's usually very secure. And she's like, Doc, I got to tell you something. And I said, your back's doing well. I said, yeah, that's doing much better, but I got to tell you the other thing. And I was like, okay. And remember I was telling you that I've learned more from my patients than I've taught my patients sometimes, and what she said was, I had the most explosive gas all day long at work. And she got a bigger smile on herself. She was just like beaming. And I said, so did you go to the bathroom? Yes. For the first time in 15 years, I was able to go without any support or anything that would help me. Could you imagine the freedom in just that part of it? She got her life back. Just imagine what that held her back from in her life just over time. And the neat thing is that we captured it on film. You can see it. Any questions on that at all? I want to talk a little bit about the care plan, the care that we're giving people. The upper cervical actually allows people to get cared for over long distances. We're specialists in what we do, and as we get better and better and better at what we do, we're finding that we don't have to see our patience as much. And what you'll see in this picture, this is a person that came in, the red line is normal where it should be, the black line is where this little girl was. This is an 8-year-old girl. Came in, a lot of neck pain and headaches. Adjusted. You see how nice and straight that is? All of a sudden, she felt better. 1 month goes by, and she's like, I'm great. Didn't see her for another 2 months. Usually I want to see people about once a week. It depends on the person, but about once a week for the first month, just to monitor things, just to make sure everything. If it's long distance, I'll try to go out a little bit further, and sometimes we can do every half month or every month, depending on where they're coming from, whether it's New York, Florida, Louisiana, people drive from there. And all of a sudden she comes back in and she's like this. And I said, what happened to you? And I asked the mom, and she's nothing. The kid said nothing. I said, something happened, because I had to take a new film, because when I tried to adjust it, it wouldn't move. Something changed. This degree right here is 2.5. Do you see this one down here? 23 degrees. That is the largest one in my practice in an 8-year-old kid. 8 years old. He had something called torticollis. You ever heard of the torticollis before? The neck will lock down and stress into a position where it is very uncomfortable, and you cannot move it. I tried moving her head, and she, just major pain on the left side. She could not move her head. I adjusted it, and all of a sudden she could move a lot better. She had to move her head, but it still didn't correct all the way back to here yet. I asked the mom and the girl again. I said, what happened to you? She said, well, I did fall off a horse. Would that do it? And I said, in my mind, I said, yeah. And she said, we ride horses all the time, though. I mean, falling off a horse, they do that all the time. And so for her, she had one extra heavy fall where she landed really close. I think she might have landed near a rock or on top of some dirt on a rock, and it threw her for a loop. So the importance of what she's gone through is this. I have a certain care set out for each of you. My goal is to not see you often. My goal is to just you the fewest number of times possible in order for you to stabilize and then heal. That's my goal for everybody. And that healing process and that stabilization process come differently for everybody. If your condition's been around a long time, it's going to take you longer to heal. The rule of thumb for healing, okay, is about a month for every year that you've been out of adjustment. So if your accident happened 10 years ago, it'll take about 10 months of healing time for you to fully recover. That doesn't mean that we see you every single week for the rest of your life. All right? That means that we will get you to stabilize, and what my goal is to seasonal checkups about 4 times a year, so your body holds and maintains that, and then we check you at that frequency for that period of time. It's a lot different than traditional chiropractic. Traditional chiropractic, how often do they want to see you usually?
Every other day.
Every other day? Is that what you said? I was going to say 3. Yeah, I guess it is every other day. So let me go through a couple other examples here. The Alpharetta Spine Center is all about is bringing life back to the body, bringing balance back to the body so that it functions and operates as well as it can possibly do. This person came in and she had a rough start with me. Okay, I don't say that from our standpoint. It's from her standpoint. She already had a surgery. 3 screws there you can see is bolting the neck together. And then you see the bone here, 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 and here, and then all of a sudden what's missing here and here? Bone. What happened is this. She had numbness in her left hand and nothing in her right hand. The right hand was fine. Went to this neurosurgeon, orthopedic surgeon, and they said, well, we're going to, these are her words. She said, well, they're going to fix me. So she went in, and all of a sudden she came out of the surgery after this first one up in here, and she had both hands numb. Then they said, well, we're going to do something called a decompression surgery. You ever see the deep sea divers, Jacques Cousteau, and the different people on TV? They go down in those tanks and they come back up. They have to sit in a decompression tank. Well, their body's getting pressure released. Well, that's the idea. They came in here and took some pliers, big pliers, and snipped the bones out to hopefully decompress the nervous system so that the communication would work better. Still didn't do it. Then she heard about me. And she called and said, can I get help? I said, I don't know. I looked at the films and I said, you've had a lot of stuff done. I said, how many thousands of dollar neck right there? This is where her misalignment was. I adjusted and it didn't change much, did it? From here to here. I made a slight change to the angle And then we did that. Her words to me after that day were, you just released about 2,000 pounds off my shoulders. 2,000 pounds that I've been dealing with for about 30 to 40 years in my life of just heaviness. That's why her neck wore out. All that heaviness, all that stress is exactly why this wore out. Now, what was interesting is after I adjusted and she said that comment, she could feel her right hand again. And so all of a sudden, she had functioning of her right hand. But the left hand was still numb, and that was going to take time. I tell you about her because I want to encourage you that there is a point where people want to give up. You know what that point is? When do you think that is? You don't know? What it is when people still feel the pain, and they're still going through it, and they keep on and keep on and keep on. And they, when's this pain going to go away? How long did it take that hand to go to that point? 40 years for her. How long is it going to take, based on the rule? 1 month for every year, right? 40 months of complete healing. But that doesn't mean, again, my goal is to get people to seasonal checkups 4 times a year. That's really not that much when you look at the whole grand scheme of things. But making sure you're checked, I mean, what is that, 16 times over the time? And that's much better than going through something like this. Any questions? Anything at all? I feel a question.
You know, people have gone, there's chiropractors and then there's chiropractors. And you know, you bring a group of people together that have been going to chiropractors for years.
Uh-huh.
And then, you know, come to you and it makes a difference. You know, what do you say to them?
I focus on what we can do for them, not what has been done. Do you know what I mean?
But how do they find someone like you? I mean,
that's why
there's nothing out there that I know of to tell the public.
I'm glad you actually asked that question. How did everybody here find out about what we do?
I only knew from my daughter.
So somebody told you. Who told you? Oh, well, who told, which daughter?
This daughter.
Okay. And so how did you find out?
About you?
Mm-hmm.
Dr. Doctor.
So another doctor. So you told and took the time to share with the people that you care about. May, how did you find out? About me, right?
Right.
Yeah, I told you.
Right.
And then also what happens is other people will tell you, probably heard through Karen, the Lings, okay?
Yeah.
They told you about what we do. So it was people telling other people. And that's really what we have. My goal this year is to get people to know what we do, to get the word out. Okay, and that's where I can't do all that. And I usually ask people to help, you know. If you've done well, tell people about us. And that's all you can do. And whether they make a decision to come in because they've gone through the gamut, we have testimony after testimony of people that have gone through the gamut. And you know what that's like. The gamut is all the orthopedic surgeons, all the neurologists, all the PT, the traditional chiropractors, even upper cervical doctors, and then they finally find their way in their doorstep. You know? But that's why it's important. If somebody has something going on that you think that might be able to be helped, you know, in my opinion, all children should be checked. I mean, just no matter what, because they had falls. The birth process itself in the beginning can cause all sorts of issues because the neck. I mean, you ever hold a baby's head after it's born? There's no muscle tissue there. It's like paper thin muscles, and it's not even supporting anything. What if the doctor then all of a sudden has to get the baby out faster? What are they going to pull on? The neck, the head, the shoulders, twist the head to get the shoulders to turn. Okay, that's one of the procedures. So there's a lot of things that can happen. The first stage of walking, any kind of fendon benders, learning to ride a bike. Who learned to ride a bike perfectly here in the first run? Not me. So that's what I would focus on, is focusing on what we can do for them and what we've seen done for many other people. This is a girl that came in, her name's Sicko, that's her nickname. She missed 35 days of school the year before. 35. I mean, that's in school days, that's, 5 days a week, that's, yeah, that's awesome, right? 7 weeks of school, it's almost 2 months of total time. Of being sick out of, she was so sick that she couldn't even play on her basketball team. They stopped her from playing because she missed so many days. Also, the medical doctor, as she explains, they knew her by first name and were just like, hey, what do you need? They were going through antibiotic after antibiotic after antibiotic, all the way up the list. And all of a sudden, they got to the end of the list. Now, what if some kind of major infection happened? She didn't have one to work with anymore. So everybody was getting concerned for her, and she came into the office. Her mom met me at a talk I was doing, and then you can see where she was. The red line's normal, the black line's where she is. We adjusted her, and look at the curve already after we adjusted her. It's already starting to come back to where it should. See, this is what we call a reverse curve. In one word to describe it, that's bad. All right? This is good, the yellow line. The story gets even tougher. She came in my office. She threw up 5 times in my office between talking with her in the consultation, through the examination, through adjusting. She threw up 5 times. And it wasn't a flu. It was just she was sick. Her body wasn't functioning. Something wasn't working the way it should. I adjusted her, and all of a sudden through that next month, it was very interesting what started happening. She started feeling better. And she couldn't put a finger on it. It wasn't like, oh, this is feeling better. This. It was just a general, I'm doing better. I know I'm doing better. All of a sudden, school, it was during the summertime, because a lot of kids come in during the summertime because the school's out. September started rolling around. She started getting a little nervous. She's like, I said, what's going on? She said, I'm scared I'm going to get sick. I always get sick in September. I said, well, let's see how it goes. The next year, she got sick only 5 times. But did you know that? I mean, she missed school 5 times. As her mom explained it in this class one day, she only got sick 1 day, and it was a minor cold. Usually, she'd make a cold look like a flu and really quick. Missed 1 day because of the cold, but then the other 4 days were sort of gimme days. Okay. Her mom figured 35 last year, no big deal, you know. But that's the type of thing that people that have come to me have taught me and shown me. You know, my job is to correct the spine. And then they start explaining what they're noticing, what's different, what they're experiencing. Medication, she has her life back. She's not on medication. She enjoys her horses. She enjoys building. She has a car that she works on. And she has her life back. And like you said, you know, how do people hear about this? She's told people. Just explain it to them, saying, you know, you need to get your head on straight. So you gotta watch that. So if somebody does say you get your head on straight, and you already know. Did you know I can give you proof? I can give you a copy of your X-rays, and you can just say, look, my head is on straight. And this is I'm not, for time's sake, this is a migraine patient that got well. I've helped a lot of people with migraines, but what I want to do, I think. Actually, this one. I have 2 more to share, okay? A lot of people ask me about curves in your neck. Remember that lady, the girl that was sicko? She had a curve that was reversed. You see how this curve comes here and comes backwards and then forwards again? That's not healthy. It should be more of a nice, smooth curve. This is where she ended up after we took care of her. You see that difference? That's where the curve should go. That's where it was at one time. It just got damaged and injured to go back to that point. She had this lady, she's in her late 30s, early 40s, and she had a lot of headaches, a lot of tension in her neck, a lot of shoulder, like a sharp pain in her shoulders. What I'm going to share right now really explains why we do what we do. We are focused on getting people straight and balanced and well. And this is a little girl that came in. She was actually being monitored by an orthopedic surgeon for 3 years at the time we saw her. The doctor said at the beginning of her problem, they said in 5 years, if she's not any better or she's worse, we are going to go ahead and do surgery. They were going to open her up and actually bolt a metal plate to her chest. And the reason was because the sternum was twisting, and you could feel the ridge along the one side. As that twisted, all of a sudden, it got worse and worse, and her posture looked like this. She had the no-name disease. There wasn't a diagnosis for this. It was just, you're twisting, and it's getting worse. And so in all your right mind, yeah, if that's the only thing that's going to stop it, let's do that. But what if there was something else that would actually help it? We talked to them one day at our church, and all of a sudden she said, I need to come see you, see if you can help my daughter. And I looked at her posture, and it literally looked like this. I said, let me see what I can do. We took pictures before. Look how crooked this is. See the red line? The black line is where she is. Then we adjusted her once, and then we adjusted her a second time, and we corrected her back to where she needed to be. Now, the beauty of this is this. This is the first time I ever saw in my office somebody their jaws just drop. You ever see Home Alone? You ever see that movie? The kid just goes, when he's shocked, jaw just drops. And I'm not kidding you, the daughter stood up after the adjustment, 5 minutes after, looked at her posture, and instead of being crooked like this, she went like this. The mom stood behind, and you could just feel her energy just like get excited. You know, she just couldn't believe it. And she's like, oh my goodness, I cannot believe it. Then I started thinking about what that mom was thinking, and the daughter for that matter, but really what the parent was. Because I have a daughter myself. I started thinking, if that just corrected, what things were changed in her life? If she's 10 years old at the time of all this happening, she's going to be a teenager soon. Then she's going to be a driving teenager. Then she's going to be in college. Imagine going to school, you know, or going to a swimming party, and you have a scar on your chest. You have to wear a certain type of suit. You're going to be very self-conscious. The thing that hit me the most, and it really hit me with my daughter, I was thinking about her, was the wedding day. And the change that it made in her life, that no surgery, no scar. I don't have to explain this. That's the type of difference that we make at the Alpharetta Spine Center. When we take care of people, we want to correct their spine back to where they need to be so their body can operate and function. So that little girls like this can have their future ahead of them. See, I mean, our kids are our future, right? They're the ones that are going to take care of us someday. And that's why we want to reach as many people towards upper cervical care as possible. Upper cervical is that possibility. Just, you know, you have a tremendous gift that your mom gave you. And I don't even know if you can capture that, the depth of that. But I think you do, because you said the first thing out of your mouth. It's a miracle to see how that works. Okay? We want to reach other people with that miracle. And so if you guys can help us out in any way by telling other people, we appreciate it. Any questions?
What is that? When the lines are parallel, I thought it would be, if it's crooked, it would be like this.
The upper one is parallel. Let me show you on me. What's happening is that neck is doing this. But the head is perfectly parallel, but the neck leans off to the one side. You see that?
Okay.
That's not normal.
I see.
This is normal, where the head is still parallel and the neck is parallel. So it's not just the head, it's not just the neck, it's all the components. We have 24 bones that come from here all the way down to our tailbone, and all of them need to be stacked up perfectly straight.
So how do you draw that red line?
We have the red line is based on the center of the neck, the center of the neck, and then we draw it straight up using a vertical.
Okay.
Yeah, good question. Did you know that I give you guys something in this class? It's a gift. For being at this class, I'm actually going to give you a gift certificate to help other people come in. I do this because we want to reach as many people towards this as possible. And the only way I can do that is with your help. And so if you ever come across anybody that needs our care, use this gift certificate. It'll be very valuable. We take them seriously in this office. And when you bring that up to the front office or somebody brings it in, we know exactly, everybody in the office knows exactly what that's about. That means that somebody reached out to somebody else so that they can come in. And they also sat in this class in order to get the information they need and took their time. Thank you very much for being here. And if you have any questions, any along the way your care, just ask the doctors in this office and we'll be there to help you. Okay? Anything else? Very good.